So, precision medicine is a concept. And what you've just asked is a very important and controversial question. It's a concept that recognizes a failure in modern Western medicine where it's sort of a one size fits all approach. The concept of precision medicine is to give the right medicine in the right dose to the right patient for the right disease at the right time to have a better outcome and save money. Everyone is in favor of it. The other concept behind precision medicine is that the reason there needs to be a personalization is every person is different, and it's largely due to their genetic makeup that is modified by age and environmental factors and habits and those types of things. But the genetics that physicians were taught in medical school is traditional Mendelian genetics, where one genetic factor that runs through the family causes a complex disease. And we know that's only true in about 1 to 2% of patients that have a syndrome, which is a disease that's defined by a combination of signs and symptoms, but it doesn't tell you what's wrong or how to fix it. So the concept of precision medicine is, how do we take this information and sort it out so that we can personalize the care with an early diagnosis of what the disease is and what it is not, to make a diagnosis using biomarkers to predict if it's going to be a mild or severe course, to choose a medication, and to make sure the medication actually is going to work and help the patient and is not going to harm them. So we all agree that that's what is needed. But the problem is, how do you put this revolutionary idea into action? And in my view, which I believe is the correct view because it actually works, is we need a new paradigm for medicine, which is different than the old paradigm that we were trained in, which is based on the germ theory of disease, where one factor causes a complex disorder, and that you can figure it out by taking a population and splitting it into people with and without the disease and identifying the one factor that distinguishes the two. That's how we were trained. But if you get into the complexity of the human body and a human genome that's, over 1 billion base pairs long with millions of variations, it gets a little difficult and actually doesn't work. We have to use a new approach. That's my definition of precision medicine.